Primary care physicians and their teams are well positioned to support patients with opioid use disorder. However, initiating opioid agonist therapy, or OAT, may be a new experience for a primary care team. The Primary Care Clinic Buprenorphine, Naloxone, Suboxone Initiation Pathway and Toolkit was developed by the Edmonton Zone Opioid Response Initiative to support you in providing this care. As part of the Provincial Primary Healthcare Opioid Response Initiative, you can access a copy of the Pathway and Toolkit to download and use at the Accelerating Change Transformation Team website. The Pathway and Toolkit provide a guideline for primary care clinicians interested in starting buprenorphine, naloxone, also known as Suboxone, within their practice. It follows a step-by-step process and includes helpful resources and considerations. If an addiction concern has been identified by the patient or one of their primary care providers, it is important to ensure a non-judgmental and supportive approach when discussing this concern with patients. Talking points to support these conversations and an opioid misuse screening tool are included in the Pathway and Toolkit document. Whether or not the patient agrees their opioid use is a problem, harm reduction approaches such as naloxone kits and needle exchanges should be explored. Subsequent appointments can be a good opportunity to continue this conversation. Maintaining a non-judgmental and supportive approach can leave the door open for opioid agonist therapy options at a future time. Additional information and tools about stages of change, motivational interviewing, and opioid use-related resources are available in the toolkit. Using the patient assessment for opioid agonist treatment in the toolkit, you and your patient can determine if they are suitable for OAT. If your patient is not suitable for OAT, consider referral to alternate treatment options and continue care. There are many other programs that can provide treatment and care for patients struggling with substance use. These programs are listed in the toolkit. It is important to provide education and discuss each OAT option with patients. This conversation could include topics like dosing requirements, potential side effects, and the commitment level required for each. The toolkit includes links to patient education resources about Suboxone that you can give to the patient to support this discussion. If the patient is not suitable for Suboxone in a primary care setting, but is interested in trialing the medication, there are alternate OAT treatment options provided in the toolkit. When you and your patient have made the decision to begin treatment with Suboxone, it is important to ensure that we do all we can to set patients up for success. When planning for treatment, consider using the following interventions: providing education to the patient and their family or other supports. Identify medication coverage or assisting in obtaining coverage if needed. Identify the patient's preferred pharmacy and connect with pharmacy staff. Engage psychosocial supports, such as addiction or mental health practitioners if desired. It is essential that patients have access to a naloxone kit in case of an overdose event. Decide on a home or clinic induction. This option is dependent upon both physician and patient comfort level. Be sure to discuss the risks and benefits of each method. Suboxone does not eliminate the chance of an overdose occurring if a patient experiences a relapse. When beginning treatment, take into consideration the patient's pattern of use, opioid type, for example long or short-acting, and route. Awareness of these factors can decrease the likelihood of precipitated withdrawal. Consider an early morning appointment early in the week to allow ample opportunity for follow-up or troubleshooting if needed. Be sure to provide your patients information on who or where to contact should they experience any problems. Initiate Suboxone using the peer guideline for managing opioid use disorder in primary care. The guideline can be found in the toolkit or on the Alberta College of Family Physicians website. Here are some prescribing tips for your consideration. To prevent an extension of Suboxone, be sure to include the date, duration, and last date of dosing. Indicate the frequency of dispensing. Provide instructions regarding missed doses of Suboxone, for example, should the pharmacy restart, adjust therapy, or contact the office. Determine if the patient will take their first dose at the pharmacy or bring their medication to the clinic for witnessed dosing. Ensure that the patient is aware that the initiation of Suboxone cannot take place if they are not in withdrawal or unable to provide informed consent. If this occurs, it is appropriate to reschedule for another date or consider home induction. Effective follow-up care can ensure that patients continue to have success in opioid agonist therapy treatment and allow for any issues that arise to be dealt with appropriately. Consider using the following interventions as part of follow-up care. Schedule your first follow-up appointment 1 to 2 weeks after initiation and subsequent appointments as appropriate for each patient. Ask specific follow-up questions at each subsequent visit. Questions about withdrawal symptoms, substance use, and overall mood and functioning can help you and your patient address any concern that may arise. There are talking points in the toolkit to support you in these discussions. If you are having difficulty with achieving a stable dose, there may be other issues present that are impacting stabilization, such as mental health issues, substance use, health issues, or psychosocial factors. The toolkit provides guidance if this occurs. If you require additional support, you can access experts and specialists through the Opioid Use Disorder Consultation line at 1-800-282-9911 or 780-735-0811 from 8 a.m. to 5 p.m. daily. Use interval urine drug screening as a routine monitoring tool. This can help to identify any issues that may be impacting stabilization and allows providers to better care for patients. The sample lab requisition in the toolkit identifies the appropriate tests to order. Prescribe carries or take-home doses based on patient stability. Engage psychosocial supports if needed to aid in relapse prevention. Making changes can be challenging, and patients may need additional support to address these difficulties. If interruption in treatment occurs, it is important to reassess the patient and their situation and continue to provide care as appropriate. We hope you will find that the Primary Care Clinic Buprenorphine, Naloxone, Suboxone Initiation Pathway and Toolkit provides helpful guidance and tools to support primary care teams in initiating this important therapy. Being able to use Suboxone as a potential treatment is beneficial to your patient panel, and we hope these resources will support your team in continuing to provide high-quality care to your patients. You can access a copy of the Pathway and Tools presented in this video at actt.albertadoctors.org under Opioid Response, Shared Zone Tools.